Isolation exercises like the clamshell, resisted hip internal rotation, hip wall slides, etc. are great for dealing with pain problems, preventing pain problems, and also just from a corrective exercise standpoint. The problem with them are they lack functional carryover in a lot of people. My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist and co-founder of the Vagina Docs, and in this video I'm going to go over the resisted twist lateral band walk. The purpose of this exercise is to train the deep hip rotators to control hip motion in real time when walking in the horizontal plane. The benefit to this is that we can create more SI or sacroiliac joint and hip stability while training our core in a more functional way that can improve walking, whether we're pregnant, postpartum, or neither, just training for general hip and core well-being. What you need for this exercise is a looped resistance band and just space on the floor. Place your band around the tops of your knees, and then a progression to that is placing an additional band around the fronts of your feet. You also have the option of just placing a band around the fronts of your feet. So that would be the second easiest option, and then where I have my bands is the hardest. So what you're going to do is you're going to hinge from your hips forward. As this leg goes out to the side, you're going to rotate through your hip and your torso. Like you're almost pulling the knee back but sitting in your hip, and then you control your leg back to hip width apart. So my leg goes out, I'm rotating. As I do this, I'm forcing my deep hip rotators to drive that action and then control back to midline or hip width apart. What I'm doing here is I'm creating rotation through movement of my whole torso and hips. So I'm almost like pulling my hip back and creating rotation here. And then I'm forcing my muscles to work by moving slowly and controlled back to both feet down. The key is that I'm not bringing my feet all the way together. I'm creating tension in the band. So typically I have my patients and clients take about 4 to 8 steps one direction, and then going that direction, my leg goes out, I rotate and I pull my hip back, control back to center, and repeat. Where you're going to feel this is obviously the outer parts of your hips, because we're creating we're preventing our knees from collapsing. But also, I want you to be in tune to deepen your groin. It's easy to not have an awareness of these muscles working, and it's possible that they are still working, but whenever you bring intention to really feeling those muscles work, a lot of times people can then connect to that. The other tips that I have are make sure your knees aren't caving together, that you're keeping your knees pressing out, and you're doing that by moving from here versus just your knees. And lastly, the key to all of this is having a solid connection through your deep core. So that's going to mean a little bit different for every person in terms of intensity of how much they need, but you're going to take up the slack in your abdominal wall by pulling your belly button in gently. You may need to take up the slack in your pelvic floor. Think about the beans that I talk about in other videos, and then making sure that your ribs stay connected to your pelvis, that you're not overarched or you're over crunched. If you have any questions about anything I covered in this video, comment below or reach out directly. Otherwise, thank you so much for watching, and I'll see you on the next video.